Most sciatica leg pain doesn't keep coming back because the nerve wasn't treated correctly. It keeps coming back because how you walk was never properly addressed. When pain shows up as sharp, aching discomfort in the lower back, the glute, or the leg, and continues to return, the real driver is often a dysfunctional gait pattern. In this video, I'll explain how gait dysfunction stresses the pelvis, the SI joints, and the lower spine, and why spinal corrections don't bode well when the gait's ignored. I'll also cover the four-step process we use to identify the overlooked cause of sciatica-type leg pain so chronic leg pain can finally improve or completely resolve. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years of experience and a background in gait analysis, biomechanics, and neurology. My mission is to provide a thorough solution to the spinal problems that develop from an unlevel foundation like anatomical short legs, spinal and pelvic misalignments, poor posture, and foot dysfunction. This channel is for people dealing with chronic pain like back pain, sciatica, neck pain, poor posture, headaches, and are looking for real lasting relief. You'll get a clear step-by-step strategy to address the root causes of these conditions and start feeling better fast. Subscribe now for real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms so you know exactly what to do next. I upload a new video every week. What most people are experiencing as classic sciatica leg pain is often the end result of a much bigger mechanical problem. A dysfunctional gait pattern can create ongoing stress through the pelvis, SI joints, and lower spine, and over that time, that stress shows up as nerve irritation and leg pain. Many people treat the symptoms with medication, physical therapy, injections, laser therapy, or even chiropractic adjustments. And while those can be helpful temporarily, the pain often returns if the underlying gait pattern isn't properly identified and corrected. The pelvis, the spine continue to break down in the same way with every step, which is a key reason why sciatica-type leg pain never fully heals and keeps coming back over and over and over. Before I explain the four-step process we use to address sciatica-type leg pain caused by abnormal gait patterns, it's important to understand how a poor gait pattern can create this problem in the first place. It often starts at the ground. First, footwear matters because your shoes influence how your foot contacts the ground and how force travels up through your body with every step. Shoes that lack proper support or show uneven wear patterns can allow excessive motion through the foot, which immediately alters gait mechanics. Over time, that altered movement increases stress not only on the foot, but on the knee, hip, pelvis, and sacrum, and even the lower spine, all of which can contribute to irritation of the sciatic nerve. One of the most common issues we see is poor foot mechanics, especially overpronation. Overpronation occurs when the longitudinal arch of the foot collapses during walking. When this happens, the subtalar joint in the foot moves excessively, which causes the lower leg, tibia, to be internally rotated. That rotation doesn't stop though at the ankle. It travels upward, placing abnormal stress on the knee, hip, SI joints, and the lower spine. If this pattern continues uncorrected, the pelvis and lower lumbar segments are forced to compensate with every step. Over time, that biomechanical distortion can irritate tissues around the sciatic nerve, in the buttocks, the spinal nerves in the lower back, and produce classic sciatica-type leg pain. When you consider that you take thousands of steps every day, it becomes easier to see how poor foot mechanics repeatedly load the pelvis and spine, eventually irritating the sciatic nerve. The key point is that unless these gait and foot mechanics issues are identified and addressed, the underlying stress pattern remains. So even if the leg pain itself is treated, you'll continually have recurrences. I equate this to squeezing a tennis ball. If you squeeze it 2 or 3 or 4 times, you won't have any issues. But if you were to squeeze that 5 to 10,000 times a day, just like those muscles in the lower back that run right around the sciatic nerve, that constant irritation will eventually create a problem. Here's the four-step process we use to identify gait-driven sciatica. The first step is a good health history. The reason we do this is health history helps us determine what's caused this in the first place. When does it seem to occur? What makes it better? What makes it worse? Those questions help us to identify true sciatica from a gait-driven sciatica type process. True sciatica will have a very distinct pattern, very pinpoint tenderness in the middle of the glute, sharp pain radiating down the back of the leg, numbness and tingling in a very distinct pattern. If it's bad enough, potentially weakness in certain muscle groups. In a gait-driven sciatica, when we ask the questions about cause and occurrences and what makes it better, what makes it worse, you'll see a different pattern emerge. One that may include problems when you're on your feet a lot more. Maybe you've taken up a new job or new hobbies or gone on a shopping trip or something and been on your feet a lot more, and that's tended to cause this either to occur in the first place or to get much worse. You'll also see certain patterns that they'll describe. It may bounce back from one side to the other, or it may be still one-sided, but caused by, again, more time on your feet. With those questions, we get a good indication, and then we can get to the next step, which is the examination. After taking a good health history, the next step is to do a physical exam. The physical exam, among other things, will look at specifically what is causing the pain or what seems to be causing the most discomfort and where the pain points are, where the stress is. We look at things like movement, both passively and actively. We look at things also like just pressure points and touching and palpation. What tends to aggravate when we press in? So again, sciatica has a very distinct pattern when it's true sciatica. Gait-driven sciatica will tend to have pain points and tenderness in certain spots that are more related to the irregular gait pattern. The third step in our four-step process to look at gait-driven sciatica is assessing posture. Posture gives us an idea where the big stress is. Kind of like looking at a house. If it's leaning one way, you know something's wrong with the foundation on that side of the house. By looking at posture, what we're looking for is where the stress is being pushed towards. If it's being pushed towards one side, what you'll generally tend to find is the joints on that side, the lower back joints, the SI joints, the hip, the knee, the ankle, and the foot will tend to have more issues because you're putting more weight each step you take. One of the issues I have with posture when we look at this is people tend to think that if you're leaning one way, that must be the side of your symptoms. This is not always the case. It can be that way, but sometimes what will happen is if your posture is translated to one side, the problem and the symptoms will actually be on the other side. One of the reasons for this is as your posture tends to lean one way, the muscles on the opposite side are trying to compensate. When those muscles compensate, they can start to become painful and or they may start to irritate the nerves that run through and underneath them to cause a sciatica-type problem. The fourth step in our assessment for gait-driven sciatica is the actual gait assessment. This is looking at how the feet move, how the knees, hips, pelvis, and lower spine function above that. In this case, what we'll have people do is go barefoot and walk back and forth a few times through the office, watching how from the front and from the back to see how the gait pattern looks. There's a very normal type gait pattern that most people should have. If people have started to change and vary from this gait pattern, it can have a dramatic effect, not only on the foot, but on the ankle, the knee, the hip, the SI joint, and the lower back. Now, this assessment helps us to determine if that's the cause of most of the pain you're feeling. It's very obvious in the 30 years that I've been working at this, when someone's gait pattern is having a dramatic effect on everything above that. Like I said before, just like a house with a foundation that's uneven, it's going to stress certain parts of the house even up further in a certain way. We've all been in a house where you've seen cracks in the walls and cracks in the ceiling. When we look at those, you know something's happened in the foundation to cause that. This is what the gait assessment does for us. It helps us to determine what the foundation's doing and how that may be affecting things further up the spine. The last thing we may do after doing these 4 steps is order an x-ray. This doesn't occur in everybody, and oftentimes is only the case in case where this has been a chronic problem. What we'll do is order x-rays, usually of the lumbar spine and or the pelvis. And the reason we look at these is to determine the stress mostly on the SI joints and the effect it's had on the lower spine. If it's been there a long time with a poor gait pattern, that stress can cause different type bone reaction in the joints between your tailbone and your pelvis. You see a little bit more bone development there, and that's just again an indication of a chronic stress that's occurred. We'll also use that sometimes to determine what's happening in the spine, how much degeneration has occurred, what the discs look like, and what the nerve spaces look like that come out on both sides of the spine. Once we've determined that gait-induced sciatica is the cause of your problems, there are a few things we can get you rolling on to help get you relief quickly. The first thing would be some spinal adjustments. The reason we do this is the spine is important to get moving and functioning properly, to get your alignment and posture corrected, and also take stress off the nerves that run down into the legs. The importance of this is that those nerves help to control the muscles that control your balance and your posture. As those nerves relax, the muscles can start to relax and give you some pain relief. Second thing we'll do is do some specific stretches based on what we're seeing in your case. Those stretches, maybe 2 or 3 of them, should help get you more relief and more movement that will help to relieve some of the pain that you're noticing. The third thing, and one of the most important things, is looking at your footwear. Footwear is incredibly important in keeping our gait balanced and the spine de-stressed. Even though we adjust and give stretches, if we don't deal with the cause of the foundational issue in the first place, the problem is going to keep recurring. So in this case, what we'll do is look at the footwear that you're wearing. May have you bring those in and assess and determine which ones may be problematic and which ones may be less than beneficial. How you can change that, and also determine if possibly an orthotic should be a beneficial thing for you. An orthotic is something you can just fit into your shoes, and it'll help to keep the gait much more balanced and supported when you're on your feet. The goal of this video was to give you a different way of looking at how sciatica-type leg pain is assessed and treated. Instead of focusing only on the nerve or where the pain shows up, you learned how poor posture and dysfunctional gait patterns can create chronic stress through the pelvis and lower spine, and that can lead to recurring leg pain. And more importantly, you can now see how correcting gait, posture, and spinal and pelvic imbalances doesn't just help relieve the immediate pain, but also creates a more stable foundation, and that will help prevent sciatica symptoms from continuing to come back. If you found this video helpful, please like and share it with someone who's been dealing with ongoing leg pain or sciatica-type symptoms. If you have any questions about this approach or anything we covered today, drop them in the comments below. I read every comment. And if you're looking for targeted sciatica relief exercises that you can do safely at home, the next video you should watch is this one. I walk you through 5 specific exercises designed to help reduce sciatica irritation and support the work we talked about today. Go watch this video next.